Hello and welcome to episode 2 of Health Cascade's Co-Creation Masterclass. We hope you will enjoy and find useful these second editions in which we pull together all the work we have been doing to date to make co-creation trustworthy. I will first introduce Health Cascade and our aim, and we will then first summarize the various co-creation projects Health Cascade has been delivering throughout Europe. These endeavors have far-reaching implications, not only in terms of the healthcare improvement that they have delivered, but also in refining our approach to co-creation. These empirical studies have allowed us to refine an evidence-based methodology for co-creation to make it trustworthy. We underscore in this edition the importance of the foundational theoretical and methodological groundwork that supported these projects, as it serves as a foundation upon which construct innovation and trustworthy solutions. In this episode, we place a strong emphasis on the ethical dimension of co-creation. We provide a glimpse into the future where we explore pioneering technological advances currently undergoing testing to enhance co-creation and the co-creation process. Innovation remains at the core of our mission, and these technological strides will continue to propel our projects forward. After this overview of our work, there are further presentations that explore these topics in great details. Let's get started. I'll leave you in the confident hand of our talented team of young scientists. But before we start, throughout the following video, presenters may refer to work package or ESR. Let me explain briefly what these terms mean and provide some context. Our Health Cascade project works around 6 key different work packages. These focus on 1, the foundation of co-creation, including the theoretical frameworks, the ethical consideration, methods for co-creation, and how to evaluate co-creation practices. Well, package 2 is about how we can maximize the use of technology to aid and enhance co-creation. And then work package 3 to 6 are practical applications, empirical projects to co-create innovation in healthcare and public health.
Kia ora, my name is Vinny. Over the next few minutes, Kunshan and I would like to give you a teaser of the different co-creation projects that we have operating across Europe. We have 6 co-creation projects on the go across 6 countries and 4 sectors. The common goal across all of them is to apply co-creation to promote public health outcomes. We would like to introduce you to the communities we are trying to serve within each project and how we are going about it. Our first project comes from Umeå, Sweden. In a second, we'll introduce you to Mats, who we have over here. But first, let me tell you about the QR code. Most of our slides have a QR code, which will take you to the Health Cascade website, more specifically to more information about the project we are speaking about. So if you are interested in what you hear, please feel free to scan the QR code for more information about the project. So this is Mats. He just celebrated his 70th birthday, and he's had quite a life. He's had the chance to travel and live in many places, finding work in mining towns across Central and Eastern Europe. Unfortunately, years as a miner has made breathing more difficult. He was diagnosed with chronic obstructive pulmonary disease 10 years ago, and most recently was hospitalized for treatment, which left him feeling a bit anxious. preventable issue for patients like Matt's is substandard examinations and early discharge, which have resulted in death or a worsening of symptoms. But thankfully, this is where our team in Umeå come in. They are applying and testing co-creation in a hospital setting to improve outcomes for patients like Matt's. They have recruited patients, their family members, healthcare workers, and administrators to develop a digital intervention that can manage the quality of care patients receive in hospitals. The team are actively co-creating and are keen to talk to you about their experiences. They're more than halfway through their 8 workshops and are applying methods like World Cafe, cultural props, card games, prototype, and user journey mapping to envision their future outcomes and pave the road that can take them there. Stay tuned to the work by the group at Umeå. As a result of their hard work, we are highly likely to see an evidence-based digital intervention that addresses discharge issues for COPD patients over the next 2 years. Our journey then takes us to Bremen, Germany, where we'd like to introduce you to Priya and her partner Mo. They're expecting their first child. They arrived in Germany 2 years ago and are still getting a handle on the language. They'll have to work together with healthcare workers to manage their pregnancy journey, coordinating communication with midwives and obstetricians. The quality of care in obstetrics is so reliant on effective communication, and poor quality of care is often the result of a failure in communication, which is unfortunately more common amongst migrant families that are expecting. This is where our team in Bremen come in. They are taking an existing intervention that was developed to help facilitate communication between pregnant women and healthcare workers and adapting it to meet the needs of families like Priya and Mo. Their approach to recruitment and co-creation in general is informed by the predecessor to this project, the Teen Baby Project, which took a participatory approach to develop patient safety interventions. The team are currently collating and analyzing data from the Teen Baby Project to inform co-creation practices when working with migrant families. Their lessons thus far have been that including end users is worth the effort. A comparison of 2 Teen Baby interventions, one that was researcher driven and one that was end user driven, found that sentiment towards the latter was significantly more positive. And engagement metrics like frequency of use, intensity of use, and duration of use were much higher when end users were involved in the development process. Moving on to Barcelona, we'd like to introduce you to Albert. Albert grew up in an extended family household with his parents, grandparents, uncle, aunt, and cousin. He is the last remaining member of his family, however, and he's been living at a care home for the past 5 years after it became harder to look after himself. It's been a huge contrast to the active and social environment that he's used to. He finds that he's stationary for most of the day and often feels lonely. And loneliness can do a lot of harm. It's been linked to a series of negative mental and physical health outcomes. But this is where our team in Barcelona come in. They're looking to use co-creation to address the needs of residents like Albert. Their target outcomes include increased movement behavior, enabling more social interactions, and reducing the risk of loneliness and isolation. They're building on the active aging framework, using co-creation to create a space suitable for addressing the mental and physical health needs of our elders. They're working with care home residents, adults over the age of 65 in the local neighborhood, and subject matter experts, and are applying methods and tools like photo voice, focus groups, semi-structured interviews, and augmented reality. And they're succeeding in their approach so far. They're working toward a design for a space that will help our elders move and connect.
Hi everyone, my name is Kun Shan. Continuing from where Vinny left off, I would like to share with you 3 other co-creation projects the Health Cascade team is currently working on. Leaving Barcelona, we now head north to Amsterdam, where me and my co-researcher Sarah Rushton are working on a youth co-creation project, also with the theme of urban spaces and health, only that our protagonists are a bit younger. Here we meet the LL trio, faces to the narrative of this project. 13 years old and attending first grade in a secondary school, the LL trio share a common dream, which is to create an epic urban space for themselves and fellow teenagers. Urban spaces play a crucial role in the health of adolescents for several reasons, such as providing opportunities for physical activity, as well as fostering social interaction and promoting positive mental health and well-being. The key aims of our project include bringing together stakeholders in the co-creation of a physically and socially activating space for teenagers, understand and explain how and why co-creation works, measure changes in targeted health and well-being outcomes, provide pragmatic recommendations for similar projects, and finally, to empower the young co-creators in the process. In our research design, we adopted an interdisciplinary approach, engaging adolescents, the local municipality, and community partners. Some key methods we have used include design thinking to guide the phases of co-creation, create project ownership, setting and negotiating the boundaries of co-creation, facilitating fun and interactive activities, as well as conducting ongoing reflections and applying iterative adaptations to our methods. We have recently rounded up the co-design phase, engaging 70 adolescents since May 2022. Pending final approval from the local government of Amsterdam, construction is expected to commence in the first quarter of 2024. We now turn to our team in Belgium, where they work within the school context to tackle sleep health in adolescents. Sleep difficulties are among the top 3 complaints in European adolescents. Research on sleep-deprived teenagers highlights the detrimental effects of inadequate sleep on cognitive function, academic performance, emotional well-being, and physical health. And here we have Lucas. Lucas, a once promising student, finds himself trapped in a cycle of underperformance at school due to a chronic lack of sleep. A variety of factors led to his inconsistent sleep quality, leaving him exhausted and unable to concentrate. His teachers grew concerned as Lucas' grades suffered. With this health challenge, our researchers Leah and Janneke aim to investigate the effects of using a shortened co-creation process to scale up and existing healthy sleep intervention. Their work also targets sustainability of this school-based intervention by involving school staff in its implementation. In their three-arm RCT research design, combining approaches of participatory action research and intervention mapping protocol, they facilitated co-creation between adolescents and school staff. Their project uses a mixed methods evaluation plan for measurements at 3 time points. Examples of these measurements include sleep surveys, actigraphy, and interviews. For the outcomes, they predict the co-creation school to have the greatest effect on sleep. They also foresee a more positive process evaluation in the co-creation school, as well as initial benefits of using a shortened co-creation process. Last but not least, follow me across the North Sea to Scotland to meet Olivia. Olivia is a passionate programmer. She immerses herself in the world of code and problem solving. However, the hours spent hunched over a computer has led to body aches and a lack of physical energy. Office workers spend up to 70% of their time at work sitting, which poses an increased risk of related health problems. Research on workplace sedentary behavior has typically focused on large organizations, even though small and medium enterprises represent more than 99% of all UK businesses. Therefore, effective interventions in this population could be scalable to have a wider public health impact. Health Cascade Fellows Mira and Lauren aim to apply and test co-creation in a workplace setting and its impact on the sedentary behaviors. Their research also aims to understand and improve the experience of co-creation. In 3 Scottish small and medium enterprises, they will work with the employees to co-create a tailored health intervention plan to reduce sedentary behavior. Some of the methods they have used were workshops featuring awareness building, brainstorming solutions, action planning, reflection, and sustainability. One-on-one interviews on the experience will also be used to collect qualitative data on their co-creation experiences. For the outcomes, our team at Glasgow expect to report co-creation as a mixed experience for the co-creators. They also expect the co-created intervention to effectively target sitting behavior without a decrease in workers' productivity. Thanks for viewing this video. We hope it has given you a small yet concise overview of how we are applying co-creation in different settings and generating scientific evidence to make co-creation in public health more robust and trustworthy.
Hi everyone, I had the privilege of presenting to some of you before at this BIMPAC conference this year, but for those new faces, I'd like to briefly introduce myself. I'm Katrina Messiah, ESR1 and PhD Fellow as part of Health Cascade, and together with my colleague Danielle Agnello, we'd like to present briefly on our work package, which is about the methodological foundation for evidence-based co-creation. Our work package, which is work package 1, specifically consists of theory-based principles, ethics, methods, and implementation and evaluation, which are the essential strands. We work collaboratively and synergistically to have 4 main emphasis, which sets us apart from other investigations. And now I will briefly articulate how. So we have the evidence base, which is about the empirical underpinning. We also have the guidelines, which is a set of guidance given to researchers and diverse yet relevant co-creators interested in navigating their co-creation projects. Further, we have the methodological framework, which is the structuring behind the work that we do. And last but not least, we have the theory-based, ethical, and guiding principles to ensure the salience of evidence-based co-creation. Elaborating on our aims further, we're seeking to go from a naive praxis to a robust methodology. A naive praxis refers to the improper use of theories and methods, and we can detect indications of naive praxis when considering the range of symptoms of co-creation challenges. And so I'll give you a few examples of this now. There is tokenism, which is when so-called co-creation research is merely a tick box exercise, and so stakeholders are not meaningfully involved or engaged, and when it is leaning more towards that consultation. Another example is concept stretching, so when terminologies related to co-creation are used in a broad way, but is conflated and as such prevents us from preserving the integral and unique definitions per term. We also noticed a lack of consensus about co-creation as a terminology. For instance, De Koning once asked, is co-creation an approach or a method? Finally, there is knowledge fragmentation, which is when research fields employ their own language of co-creation, thereby working in silos, and as such, when we zoom out, we lose out on a shared understanding of what co-creation is and does. So instead, we're inclined towards enrichment, resulting in a robust methodology involving more effective collaboration, the incorporation of more creativity towards innovative intervention development at every stage of the research process, meaning from problem identification to evaluation, in line with Vargas et al.'s work in distinguishing co-creation as an overarching principle. For this next segment, I, and then Danielle, will be referring to the work development so far pertaining to the 4 strands I pinpointed earlier in this presentation. To begin with, we have the theory-based principles for co-creation in public health. This is my PhD work and I'm based at Amsterdam UMC. But so you may be wondering, why theory-based principles? So I will now share with you 3 key considerations justifying this strand. Firstly, by drawing on established and explicit theories, co-creation efforts are more likely to be effective in achieving their intended outcomes. Principles derived from theories can shed insights into the factors that influence, for example, behavior change, community engagement, and health promotion, which can elevate the co-creation process for maximum impact. Conceptually, theory-based principles can help clarify the goals and objectives of a co-creation initiative, for example, by understanding the desired outcomes. Finally, theory-based principles integrate scientific evidence and knowledge into the co-creation process, so in that way guiding decision-making in an optimal sense. In doing so, researchers, practitioners, and policymakers can make informed choices regarding intervention strategies as part of co-creation. Against this backdrop, I have 3 broad objectives for my PhD: to delineate the theories used for co-approaches in public health research and beyond, to address co-creation not merely conceptually but as a process underpinned by theory, and finally to deliver on core theory-based principles for co-creation in public health. So aligned with those broad objectives, I have 6 main studies. First of all, we have the systematic review of the contemporary theories used for co-approaches in public health research. This work has been published in the journal Public Health, Oxford University Press, and you're welcome to view this article online. But for now, I'd like to share a couple of main outcomes. First of all, there's been a limited use of explicit theories used for co-creation, co-design, and co-production in public health research in the contemporary period, which would signify the need for more progress to be made in terms of theory development. And not only this, but the 10 articles included from approximately 4,000 across the 4 databases, none employed a working definition of the co-terms. And this highlighted the need for the second study, which inductively identified explicit dimensions of co-creation across various research fields. The third study narratively extrapolates the methodological principles of critical realism from the information systems field to enrich the evidence base of co-creation in public health research, as it helps us to capture the synergies among structure, context, and mechanisms for better and more critical public health intervention development. The critical social theory of empowerment is also analysed in terms of how it is enacted from the perspectives of a Dutch non-governmental organisation in the 4th study. The 5th study will incorporate a multi-source analysis design, including the grey literature, to expose how roles linked to co-design and co-initiation are part of the co-creation process in the public health sector. And finally, the 6th study will ensure a type of consensus around establishing core theory-based principles. Next, I'd like to present the work of my colleague Rabab Krifu. She is another PhD fellow of Health Cascade, but based at Ghent University. She deals with the ethics of co-creation in her work. She would say ethics is important because it is all-encompassing in research and informs good practice. There are distinctive issues posed by co-creation, and therefore it is key we address those appropriately through ethical considerations. Finally, by progressing our consciousness of ethics, we can increase the quality of co-creation. With that said, Rabab's objectives for her PhD consist of analysing the ethical discourse of co-creation in a systematic regard, notably through scrutinising the existing guidelines on ethics and the empirical base of ethics. She will then proceed to elaborate a more rich understanding of the ethics of co-creation via a normative analysis to see how actions can be warranted throughout the process. She will also consider methods by developing and testing them to enhance the quality of ethics in the co-creation process and also heighten the ethical consciousness attached to that. So to expand further, Rabab takes steps to develop an ethical underpinning for co-creation. As you can see in this pyramid, she starts off broadly with an empirical exploration of the actual norms, values, and ethical principles that may be relevant to the co-creation process. Then she looks at the existing and potential ethical theories for co-creation and reviews the existing ethical guidance to explore gaps in the literature. After this first exploration, the ethical and empirical findings will be analyzed and steps will be undertaken to draft foundations for ethics in co-creation. She will perform 4 studies that will contribute to the ethical underpinning for co-creation, and these studies vary in terms of methodology and they form a comprehensive whole. For the theoretical foundations of ethics in co-creation, she will explore whether there is existing evidence on the moral reasoning and ethical decision-making of those involved in co-creation. Dilemma cafes will be conducted to inform empirical ethics. A normative analysis will be conducted to shed light on co-creation based on 3 selected ethical perspectives. And lastly, methods will be developed in collaboration with the youth to aid in improving the ethical quality of the co-creation process. So I'd now like to thank you very much for listening and say that I hope you found that informative. I'd like to pass the presentation on to Danielle to talk you through the last 2 strands of our work package, as well as discuss some key takeaways.
Hello. For those of you that I have not had the pleasure of meeting, my name is Danielle Marianiello. I am a Health Cascade PhD Fellow based in Glasgow, Caledonian University, and I'm part of the Health Cascade Network. This is the second part of a 2-part presentation with my colleague Katrina Masaiha, who has presented about our work package. Work package 1 that focuses on the methodological foundations for evidence-based co-creation. She has talked through theories and ethics, and now I will go through my research and a colleague's research about methods, implementation, and evaluation, and some key takeaway messages. So I want to start with talking about methods for co-creation. This is the basis and the kind of meat of my PhD research. So why do we care about methods? Methods provide a structured and systematic approach. They can make findings more trustworthy and credible. They enable others to even replicate your work or build on your findings. And they allow for control of potential biases or factors that may affect the results. So I want to go about this through 4 approaches. First, I'm focusing on establishing a working concept of co-creation. This is incredibly important because co-creation is a diffuse concept, and there's different terms that represent it, as well as it's been developed and kind of articulated in different fields. So I found it incredibly important to set this first container of what co-creation is for my research. Then I did an inventory of methods applied in co-creation and a comparative analysis of the methods to each other. I took all the methods from the inventory and started to create a faceted taxonomy, which is a way to organize methods and enable the selection of appropriate methods for a specific co-creation project. And finally, I'm looking into assessing the methods with using certain criteria to be able to look at process and outcome of the method. To do this, in order to establish the working concept, I collaborated closely with multiple different Health Cascade colleagues and co-led this work with Quentin Loisiel to create this concept of co-creation. What you see is published now in the Journal of Medical and Internet Research, and these are the different terms that are represented within our co-creation concepts. As you can see, there's co-creation, co-design, co-productions in there, but as well as the participatory research forms like participatory action research and public participation and community-based participatory research. Then I did the inventory and compared methods to each other, and much to my surprise, there was very little overlap in terms of the methods applied in academic, empirical, and case studies, and in gray literature sources such as reports, guidelines, and different selection tools. Additionally, I've developed a model to help build the language of how these methods are compared to each other and what a method is actually achieving in the co-creation process. The model is looking at things from participation, empowerment, and collective intelligence. Additionally, I created an organizing system based on a faceted taxonomy that's making it possible for people to select methods considering different aspects such as the participation empowerment model, as well as resources, mode of delivery, target group, and other key aspects. And finally, to assess the success of the method, I've sourced different process and outcome criteria that can be applied to understand if your method has achieved what you set out to achieve in terms of transparency, inclusivity, satisfaction, as well as representativeness and procedural components. Thankfully, I have been entrusted to present on the behalf of my colleague who's leading the research on implementation and evaluation and co-creation. Her name is Juliana Rafaela Longworth, and she is based at Blancana Institute in Barcelona. Why are implementation evaluation aspects important to co-creation? Well, contextual assessment and the adoption of system thinking approach can help you make your co-created solution fit for purpose. Also, co-creation can be a valuable approach when adapting an intervention into a new context. And finally, evaluating the intervention process is crucial to ensuring your process is impactful, evidence-based, and replicable. She wants to go about her work following these three main objectives. The first is systematically analyzing implementation field and existing frameworks through the lens of co-creation. Then she'll observe how adaptation through co-creation has been done so far and develop recommendations for future studies. And finally, she'll develop a deeper understanding of how process evaluation has been carried out in previous co-creation studies. Juliana is aiming through her doctoral research to offer guidance on how to evaluate co-creation for public health. She has so far looked into different aspects. For instance, she's looked into implementation frameworks that can guide the assessment of the context and environment of your co-creation setting. She has reviewed the use of process evaluation in co-creation studies and is currently analyzing and clustering components to develop process evaluation framework. She's also looking at the moment into studies that have been adapted interventions for the use of co-creation and exploring frameworks and steps to be used to offer recommendations for adaptation through co-creation. And finally, she's planning to create a visual evaluation graph and flow that can guide your choice of the type and method for evaluation. And she's also very excitingly recently presented this work actually about exploring the use of co-creation in low and middle income settings. Hopefully you got a chance to learn about theory and ethics from Katrina's presentation. But if you do not to worry, we have some key messages we want you to walk away with. In terms of theory, we encourage researchers to be directed towards all the named theories covered in Messiah and colleagues' systematic review. That includes also questions about empowerment theory and wondering whether it's more relevant than other theories for co-creation. We also encourage you to use critical realism methodological principles to enrich the evidence base of co-creation as an approach for public health research. In terms of methods, we encourage you to report the details of how you co-create with people so that others can replicate your work and learn from what you did. And selecting the appropriate method for your specific context or set of co-creators is imperative for successful co-creation. In terms of implementation, we'd like you to consider adopting a system thinking approach to your implementation of co-creation. Regarding ethics, the role of ethics is often invisible, but at the same time fundamental for the co-creation process that is of high quality. And merely focusing on the outcomes and practical steps is a blind practice and leaves out intention, values, principles, and norms of those involved, aspects that one needs to be conscious of when willing to establish co-creation that has a heart and a mind. Regarding evaluation, evaluation is key for purposes of replication, transparency, and understanding the impact of co-creation. Applying a formative evaluation allows for the valuable chance of adjusting the intervention according to your co-creator needs and perceptions. And if possible, it's crucial to plan the evaluation before the intervention kicks off. Thank you very much for your time and for listening to our presentation, both Katrina's and mine. I hope you found this enlightening and you know a bit more about what we're doing at Health Cascade. Please feel free to engage with us on our different social media platforms. We're quite active on LinkedIn and Twitter, as well as Instagram, and you're more than welcome to access the multitude of resources that we've made available on our website. Please stay connected with us and help us make co-creation evidence-based and trustworthy. Have a wonderful morning, afternoon, or evening. Ciao for now.
Welcome on this presentation of the working group working on the technology that can enabling co-creation. My name is Quentin Loisel, and with my fellow George Balaskas, we are going to introduce you the objective and the project of our working group. So let's start with a bit of theoretical consideration. So to do our work, we take three dimensions into consideration. So the first one is the human aspect, which is fundamental in co-creation. So we are going to think about experiences, limit, bias of co-creators. Then we are going to think about the specificity of co-creation, features, value, method, and then start to understand the dynamic inside, which can raise questions about collective intelligence, knowledge sharing, governance. When we have an idea about this, we try to understand how technology can come and support the situation. Technology has its own world with functionality, material, hardware, artificial intelligence, and basically implementing that with human raise also new questions like accessibility, usability, ethics. So basically we keep that in mind and to be able to approach our goal. So our goal can be seen through four levels. The first one, how digital technology can improve the process. So basically by doing what co-creators are doing, but better and faster. The next level is about how to enrich the process and maybe give new perspective to the co-creators. Then how it can enable the process. In this situation, maybe what are the technological solutions necessary to optimally reach what theoretically we would like for co-creation. And finally, a last level, which pushes us to think about beyond what is already available. Since digital technology is a very fast-moving field, we need to think about how maybe future technology or actual technology can transcend co-creation and bring it the next evolution. To achieve our goals, we have three main approaches. The first one, understanding the situation. What are the usages of technology? How to organize this technology? What are the urgent needs from digital technology? Then we try to bring practical solutions by improving what people are already doing, but also creating this very necessary technology and testing them to see how people react and the process is reacting with them. Finally, as we said, there is not a lot about digital technology for co-creation. So there is an important to establish some theoretical foundation for future work and also about establishing ethical guidelines to be able to forecast the future technology and to create potentially a blueprint that will help the next technology to be developed and fit perfectly for co-creation. So these approaches and goals are basically materialized in projects. So you can see two main paths, a theory and a technologies. So the idea is that we are first, one of our objectives is to establish theories, understanding the needs. And another one is developing actual practical tools, which is about technologies. So you can see that there is a green one, which are accomplished projects. There is orange for ongoing project, and there is blue for future projects. They are connected together because some of them are necessary to lead to the next project. So they follow kind of a rational logical evolutions, which explain why there is some that's on the left, more ongoing or accomplished, and the future one on the right. So I'm going to present you first the theory path. So first, an accomplished project, the co-creation database. So usually when you do your research, you start by a literature review to know what has been done. This is what we wanted to do, all of us in our consortium. Unfortunately, co-creation is a very, very popular topic and also a fragmented field of research. So we faced a huge quantity of papers, and we were a bit afraid to exclude something interesting by excluding some keyword or some field of research. So what we decided is to put all our effort together, and with the cooperation of an AI, being able to develop a database that will aggregate all the knowledge of co-creation together and being useful for everyone who want to search something about co-creation. So this is, we starting from 165,000 references, and we finish with 13,501 references. The project has been a success. We went 5 times faster thanks to this innovative methodology, with 80% of relevant papers and only 10% of false negative, which is the level of a human screening. This database was necessary to be able to lead to the next project, which is still an ongoing project, the need assessment, and most especially the scoping review. So basically for the need assessment, the objective is to assess the needs and the usages of digital technology, and ideally to be able to identify the next high potential technology to develop. We use two methods to combine methods, so two different projects. One is a scoping review based on scientific literatures, and the next one is a need assessment directly done with experienced co-creators. So the preliminary result about this is that people are using technology as an aggregation of technology, fulfilling some needs they faced during their process. So it's not really thought, except if there is like a very hard requirement, but it's more like, oh, I'm doing my methodology and I need that and that. There is definitely identifiable functional needs and non-functional requirements like quality expected for the technology. And for example, there is a need for a technology that can bring evidence-based knowledge to co-creators in a fast and certified way, and also automatic transcription, summarization, and aggregation of all the idea produced during the process. Also, one of the needs is to classify the digital technology, which leads us to the next project, which is a taxonomy of digital technology to try to classify these different technology and help co-creators to make the best choice for their digital technology. So it's also useful to establish finally a definition of what is digital technology for co-creation and establish some theoretical foundation for future work like forecasting and ethical work. So the nice thing is that we are able to maybe conceptualize an ecosystem for digital technology, and maybe with two different categories of technology, the core technology that can be called technology for co-creation, and more complementary technology that need to be connected to the process in a way or in another. So this is for the accomplished project as an ongoing one. So the future project for the theory path is then forecasting digital technology for co-creation. So being able to think about what are the future technology, and an ethical work to be able to establish ethical guidelines for technology in co-creation. Now I'm going to give the floor to my fellow George Malaskas, who is going to talk to you about the different technologies we are developing in our working group. Thank you for your attention.
Hello everyone, my name is George Balaskas and I'm working with Quentin Loisel in Work Package 2 with the aim of enabling co-creation through supporting technologies. Our approach in enabling co-creation is twofold, as you can see from the graph on the slide. Quentin has already presented to you the theoretical aspect of our approach, and my goal is to present to you the technologies that we are developing as part of our project. For us to start developing technologies, we needed to identify technologies that were not already implemented and readily available, and that we could reasonably implement with the resources and expertise that is available to us. If you look at the technologies path of our project roadmap, you can see technologies that we have identified as needed and feasible for development. We have been working on a question answering system that is ongoing due to the rapid changes in the field of large language models. We have finished the transcription tool, and we have identified a number of future tools that we will mention later on in the presentation. The aim of the question answering system is to provide an easy way for the facilitators and co-creators to interact with knowledge information. We have designed the system to address three needs. The need for fast access to knowledge in a way that is easy to use, such as a question answering system that you can interact with. The need to synthesize said knowledge from multiple documents and multiple sources, so not just a single document or a single source, and the need to bridge different knowledge sources such as the co-creation database, academic repositories, Wikipedia, and documents from our co-creators into a single cohesive source that you can extract information from. Our objective was twofold. The first part was to create a unified knowledge database, and the second part was to create an interactive question answering system that allows users to easily query that knowledge database and extract information from multiple sources that we then synthesize into one cohesive answer. And to address these objectives, we decided to answer questions using knowledge sources as our basis. And this ensures that the information we provide is evidence-based, and we have unified our knowledge sources into one knowledge database that is based on, again, the co-creation database, other academic sources, such as Archive and Wikipedia, and our knowledge database can also be expanded with documents that are domain specific and provided from facilitators and co-creators for each project. So here is the architecture for the QA system. The user asks the question, and then that question is forwarded to the knowledge database that contains the co-creation database, Wikipedia, custom domains from the user, and whatever they want to include. From there we retrieve the top 100 relevant paragraphs from the database, but 100 paragraphs are too much for the user, so we want to lower this to the top 10. And to do this we use a model to re-rank the paragraphs to make sure that the top 10 are always the top 10 most relevant. And following that we pass the question and the top 10 ranked paragraphs to the large language model to synthesize an answer for the user. Then we take the answer and the top 10 paragraphs and we present them to the user. We give him the answer and where this answer was generated from, where it was derived from. And then the user can ask more questions to further get a better image on that specific answer, or they can go to a different topic and they can choose whether they want to include the previous answers as memory or if they want to just move on and ask something completely different, completely new. So the next tool that we want to present is a transcription analysis tool that was created to address three needs. The first need that it was created to address is the need to minimize the tasks and the time spent for the facilitators. Facilitators usually keep an audio or video recording of what was said during the co-creation session, and one of the most time-consuming tasks for the facilitator is transcribing and analyzing the data from these recordings. Another need is to be able to rapidly provide an output and a written record of the co-creation sessions to the facilitators for dissemination to the co-creators. This helps the co-creators feel an increased sense of ownership as they can see their effort materializing into something in the short term. And finally, the last need is that since we are a pan-European project, we need to address multilingual setups, and this tool is a very effective way to tackle this issue. Our objective for the tool was to create an easily accessible web service that everyone can use, with the capabilities of transcription from a range of 9 languages such as English, Dutch, Spanish and more, translation from non-English languages to English, and summarization of what was said in the recordings into small paragraphs for easy use to go through them, and topic modeling to be able to delineate the different topics of what was said in every recording. The flow of the transcription tool is very simple. First you visit the website, you enter your name and email and choose the language of the recording, and then you choose the file that you want to upload. It accepts both video and audio recordings, but it just extracts the audio from the video. Then after a few minutes, depending on the size of your recording, you get an email that has a PDF and a Word document with the transcription translation if the language is not English, and the summaries of the meeting recordings, and 2 more files that contain the topic modeling and other analysis. Finally, for the technology path of our project, we have envisioned 3 more steps. We want to combine the transcription tool with the QA system, so you can ask questions based on your recordings and use them as context of other more general questions that you might have, or for specific questions on your recordings. Then we want to create a technology selector tool based on the taxonomy of technologies that helps you pick technologies based on your project. And finally, we have identified the need to properly assign contribution to the facilitators, co-creators and various stakeholders. So we are interested in working on the Co-op ID project, which will function as an org ID for co-creation. Thank you very much for your attention, and please don't hesitate to send me an email if you have any questions.
Should you have further questions or would like to speak with us, you're welcome to contact the Health Cascade team. Our emails can be found on the Health Cascade website under the Working Groups tab. Finally, stay connected with us for future updates via our social media links you see on this slide. Till then, goodbye.